Today I'm here to support the Valemount Community and their healthy initiative around the Bigfoot Walk, and I want to provide information to the men of Valemount because there's disparities between male and female healthcare, and over time we think us men tend to bury our head in the sand when it comes to our own health, and we just want to put information out to the guys to let them know there's some support in Northern Health for you. We've got some information, start small. Work your way up. You don't have to make all the health changes at once. Just take it easy, go slow but go steady, and improve your health now while you can, so that you can have a healthier life, right? A better life.
What would be a good first step for men?
For men, I think looking at the waste, right? And we don't want to avoid the D word here, right? Healthy eating. Start not by doing anything negative, but start by eating healthy. Right, there's a big difference, because when you start to say I need to lose something, you tend to contract a little psychologically. So what you want to do is to add something to your diet, add something nice to your diet that's going to be good for your health, like fruit and vegetables, as much natural and organic product as you can, and that would be the starting place. And move. Little movements, doesn't matter. Get yourself moving. If you work at a desk in a desk job and you're sedentary, make sure you get up and stand, even for a little bit. Every move counts. That's one of our key messages.
Right. I guess prevention is always good advice too. I know that men are notoriously reticent to visit the doctor. Is that advice you would give to people to see their doctor more frequently?
Yes, exactly that. Once you get into your 30s and 40s and beyond, actually, young men should be doing their own healthcare checks for testicular problems, right? Once you get beyond that, you want to go and get checkups regular in case if you have any colon cancer in the family or anything like that. Don't bury your head in the sand. If Uncle John's had it, go to your doctor, get checked up. I think us guys, we don't really want anybody to find anything, and we don't want to consider unhealthy parts of our life. We want to go and work and do our thing and just do that and not think about ill health. But the idea of getting checked up with your physician is to keep your good health. It's not to find bad health for you, it's actually to keep what you've done good. And the doctor's there to give you advice to say, maybe you could cut down on some of your calorie intake or something like that, or use healthy alternatives to what you're actually doing, and get good advice and get checked up for your blood sugar. Blood sugar's an easy one to get checked. Go to the pharmacist. Lots of pharmacies have blood pressure cuffs. Check your own blood pressure now and again, just make sure you do it proper, that you're well rested. That you're not running and jogging, you put it up through the roof. But if it's high, then it's time to make a doctor's appointment, go get the doctor to check it out a few times. Things like that, simple things, not big things. Start small, read. There's lots of information on Google everything nowadays. I think should be one of the key messages. Google it, but I don't know if I can say that because Google's a company, right?
Any other advice you'd like to give the males of our species?
Yeah, the main thing I would like to say is that we need to look at also our relationships, our community. Make sure we're engaged psychologically, that we talk to other men about stuff. Simple things, just engaging in conversations about football, hockey, things like that are a good starting point for get yourself engaged with other men and other females in your communities and talk. Psychological health is so important, and men tend to we can isolate ourselves. We don't want to talk about problems, we don't want to be seen as having problems, and so we can tend to isolate a little, and sometimes that isolation turns into depression, anxiety, and there's no shame in that. Get it fixed. So this is the Men's Health Survival Guide, which is an instructions manual on how to do life if you're a man, and it has lots of information such as like table of contents laid out for guys. It's a map towards healthy living.
So not a lot of reading, a lot of pictures.
A lot of pictures for guys, and healthy eating matters, for example. That's one of the key phrases. it's a wealth of information, and all the information is very much research based, and but it doesn't go into a lot of detail. It doesn't burden men with lots of detail. It gives you a quick, snappy look. Great for the bathroom. Wonderful for the bathroom. And you look at like quitting smoking. One of the greatest things you actually can do for your health. If you do that, quit it. But it's hard. Drugs, sexuality, lots of information that guys need to know to prostate cancer, things like that. To keep ourselves healthy as we can be, so that life can be a joy for us, right?
Great. And so for more information, if men are interested in finding out more about male health issues, who should they contact?
Well, you can go online to northernhealth.ca and go to the men's health webpage, which is basically this online. Locally, you have your local healthcare clinic. There'll be people there that can give you advice there. And your doctor is a great place to go. Your own physician, to see your physician, ask them questions. I know they have, sometimes they have a very short period of time, but they'll be able to refer you somewhere where there's good information. And going online, just being careful that you go to the right appropriate sites. Some sites are a bit. Look for sites that have been validated by healthcare authorities and the like, and look for linkages from healthcare authorities to different sites. That's a good way to get information that has been researched and validated.
Right. Well, great. Thanks very much.
Well, thank you.